Martha Raymond, and I'm the founder of the GI Cancers Alliance. We celebrated our 10th anniversary this year at ASCO GI, so that was exciting. And actually, this year I celebrate my 40th year in the GI cancer advocacy space. So my entire career has been in the space, and I can't imagine doing anything else other than what I've been able to do. So our first poster that we presented this year at ASCO GI 2025 was a follow-up to our unmet needs presentation and abstract that we presented last year, where we surveyed and interviewed GI cancer patients, over 1,100 patients across the United States, to better understand their unmet needs and gaps in services. And so with that initiative, it took us all around the United States, speaking to individuals both online and in person in focus groups and advisory boards. And we really wanted to get a sense from many different types of communities, those in rural areas, urban, underserved, those that, patients that are lucky enough to be treated at a center of excellence, et cetera, to get a broad range of perspectives. So from the learnings we understood last year, this past year in 2024, we implemented some new programs and initiatives, to meet those unmet needs for our patient community. One of them was quite a large-scale effort in biomarker awareness and testing, because we understand that so many individuals aren't aware of what biomarker testing is and how that can benefit them and their treatment protocols, throughout the whole care continuum. So that was a great, initiative, and we continue to build upon it throughout 2025 and look to really get into more communities where individuals still aren't being, able to access biomarker testing. So we have lots of work to do, but, we certainly have a plan to continue to be a part of our patients' journey and make sure they get the testing that they need. Another unmet need that we discovered was in the mental health space. So many patients, go through so much when they're diagnosed, and we really wanted to let them know, first and foremost, that they're not alone and that so many patients are struggling with the same concerns. So we are working with one of our amazing pharma partners to implement a mental health campaign for cancer survivors, newly diagnosed, and also caregivers who, as we know, deal with so much in caring for their loved ones. So that is something we're currently working on, and look forward to sharing more once we launch that, which should be hopefully by ASCO in June is our plan for that. And then another piece that we learned so many patients struggle with, I think especially in the GI space, is making sure they receive adequate nutrition. So we launched a kind of a pilot program in the gastric cancer space for nutrition awareness, simple, easy recipes, videos, a cookbook, so that patients who, like myself, maybe are not good cooks, are able to make nutritious meals that, can help them stay on their course of treatment and just feel better overall while going through the experience. So those were a couple of the things we worked on. And like I said, we plan to continue those projects and initiatives and carry them through, throughout 2025 and beyond. Our nurses and practice managers really on the front lines of all the work we do. And anytime we have information that we want to share, our wonderful nurses are the first to say, we will be sure the patient gets the information. So one of the things we've learned throughout our patient-reported outcomes research is that, of course, the internet is wonderful at connecting patients, and caregivers to resources. But what we've learned is that many individuals don't have access to the internet, or at least reliable access. So we've really taken the steps to create our programs and our information into tangible materials that we can have at oncology centers, and so that our wonderful nurses and staff can actually hand individuals, whether it's a postcard, whether it's the direct information, whatever that might be, so that patients can then contact us and we can say, okay, we can download you whatever information you might need, and we can put it in the mail, or we can get it to you however is best, is best for that community. So we're really trying to meet patients where they are, understanding that not everybody likes to get their information online, and working in partnership, like I said, with our nurses and practice managers and patient navigators, et cetera, to make sure patients get the information in a timely manner. Our advocacy organization, our alliance, our GI Cancers Alliance, has grown to include about 115 advocacy groups that are a part of our alliance, so that we do represent all of the GI cancer disease states. And for individuals that may need resources, if they contact us, we are happy then to put them in communication, if they'd like, with a specific advocacy group that may represent their type of cancer. So we continue to grow, and it's a great alliance because we're all working toward the same goal of making information accessible and resources accessible to our entire GI cancer patient population.